Hi everyone, I'm Dr. Razali Omar. I'm one of the cardiologists and I specialize in cardiac electrophysiology. We are now in the CVSKL operating theatre stroke cath lab complex, and I'm going to walk to my dedicated electrophysiology lab where I do all my cases. Let's go. Welcome to the EP lab. This is one of very few dedicated EP labs in the country. Many hospitals have got cardiac cath labs and maybe they share between the interventional cardiology and electrophysiology. But here at CVSKL, we are very fortunate because we have 5 operating theatre rooms, 2 of which are for cardiac surgery, where they do all sorts of open heart surgeries and lung surgeries. 3 of them are for cardiology, stroke, vascular. One of them is a dedicated hybrid lab, and 2 are for cardiology, of which this is a pure EP lab. Welcome. In this EP lab is where I spend most of my time. EP procedures usually takes a long time. It's very complicated, and when we have to share this OT room with our cardiology colleagues who usually deals with emergency cases like heart attack, then it makes it very difficult. But here I am not disturbed. I just perform a 5-hour atrial fibrillation procedure, and no one is asking me when I will be finishing because they want to use the lab. And I think for a hospital that is dedicated to cardiology like CVSKL, it is important that electrophysiology have their own dedicated lab. And it is not only having a dedicated room that is important. You will realize that we have to have the best machines and the best devices to help us to do a good job. And one of the things that you can see here, and this was a case that I just did, and this was an atrial fibrillation case where it was done using radio frequency energy, but using the state-of-the-art 3D mapping system. In CVSKL, we use the Carto 3, and I have the latest version, which is version 6, and we are going to upgrade soon to version 7 and version 8. And this allows us to do a great job. At the same time, we also have, for selected group of patients, atrial fibrillation that is ablated using a different source of energy, which is now using cryo energy, freezing instead of burning. And here you can see we have the cryo console by Medtronic, where we can perform cryo balloon cryo balloon catheter ablation for atrial fibrillation. So we do give a whole range of procedures, ranging from cryo balloon procedures to radio frequency catheter ablation, ranging from simple cases like supraventricular tachycardia to very complex cases like persistent atrial fibrillation or ventricular tachycardia, either ischemic or non-ischemic. Apart from ablation services, to have a complete EP services, one must also have a full range of devices that we need to implant. When a patient has got very fast heartbeat, the treatment is catheter ablation. But when the patient has got very slow heartbeat, the patient will need to have a pacemaker, and there is a full range of pacemaker. Pacemakers are not only meant for slow heartbeat, but there are some devices that we implant for patients who are at risk for cardiac arrest. So here in the CVSKL, we implant from the latest pacemaker, which includes the leadless pacemaker called the Micra. Normally, the pacemaker will be implanted using a small incision at the chest, and a wire is implanted. But for the latest technology, we implant the pacemaker without using wire and without having any surgical. It's just going through the legs. This is a range of all the pacemakers and ICDs and CRTs that we have. So here, if the patient has slow heartbeat, we implant a pacemaker. If the patient has got at risk for cardiac arrest, we implant an implantable defibrillator. What does it do? Implantable defibrillator gives an automatic shock to the patient when the patient has a cardiac arrest, and hopefully that will be able to resuscitate him. When the patient has heart failure, we implant a device called resynchronization therapy, we try to resynchronize back the heart failure and improve the heart failure. The full range of EP services also include for patients who are at risk for stroke and they cannot take anticoagulants, blood thinners. Here at CVSKL, we implant the left atrial appendage occluder, and we are very experienced in implanting the Watchman device in this hospital. I hope you enjoyed your virtual tour of our facilities here at CVSKL, where I have the pleasure of showing you around my EP lab, the kind of things that we offer at CVSKL, the full range of ablation procedures, the full range of implantable devices. I hope, perhaps I better not say I hope to see you all here. I hope not to see you all here, but if you do need our services, you know where to come. This is one of the best facilities in the region. With that, I will say adieu, bye-bye.